Hi, everyone, and good afternoon from Singapore. Thanks for joining today's webinar. I'm really proud and happy to launch this paper today, Policy Pathways for Value Assessment and Reimbursement of Digital Health Solutions. Today, we will hear from Arif Fahim from Abbott, Anh Bourcet from Johnson & Johnson, and Chris Hardesty from KPMG. And I know they will introduce themselves a little bit later, so I will not spend too much time on the introduction now. But if I can start with a very simple technical instruction. So if you have any questions, we are more than happy to answer them. Please use the chat and you will be able to interact with the speakers. Next, please. So for those who don't know me, I manage the Digital Health Committee at APACMed, and this paper is part of the work we are doing on digital health. So this committee was created 1 year ago now, and we embrace now more than 120 members from 45 companies who came together with two main objectives: creating and sharing knowledge around digital health and advocating for regional policies that can enable digital health in the APAC region. And this paper clearly covers both objectives. One is creating knowledge on such a crucial and complex topic, that is the assessment of the value of digital health solutions and the reimbursement. And also the second objective, which is advocating for fit for purpose, optimal policies in the region. So I think this is a very important piece of work. Before I hand over to Chris, I would like just to tell you how we are going to work today. So Chris will introduce the paper. He will tell you why we came up with this work, what was the process, and then he will just highlight the key messages and key recommendations that we provide to policymakers. And you will see they're very actionable and specific to digital health and to our region. And then we will hear from Arif and Anne in a panel discussion at the end of this webinar, and they will provide their perspectives and try to answer to the questions about this topic. And then I'll come back at the very end of the presentation to close and to provide you with some next steps on the how we are going to use this paper for our advocacy initiatives at APACMed. That's it from my side. So thanks a lot, Chris. And I mean, the floor is yours. And I want also to publicly thank you for supporting us in writing this paper in the past 4 months. So thanks a lot, and over to you.
Great, thanks, Roberta, and to everyone out there who has joined us today. I just want to say congratulations to APACMed, its members, and the constituent parties on working on this very important initiative that we're going to cover today. Roberta said 4 months. I think it's actually been almost a year in the making from kind of start to finish, and definitely not easy to have done that all during the COVID period with many other priorities and basically an entirely virtualized way of field research and advocacy. So perhaps a bit of a new normal within that. I know there's a lot of signups for today. I think that the topic of healthcare and the topic of digital health probably has never been higher. So a lot of interest, and looking forward to hearing from all of you out there about your thoughts on this paper too. So as Roberta said, my name is Chris Hardesty. I'm the director of KPMG's healthcare and life sciences practice based in Singapore, and I'll be your kind of moderator and MC today. Roberta already covered the agenda, so I'm not going to go through that again. She covered that very well. If you do have your kind of thoughts or comments on the matter, I mean, please do feel free to put them in the chat. We'll either try and kind of, reply to them in the chat, or otherwise the session is being recorded so we can follow up with you after too. I know many of you are passionate on this topic and have views on this topic. So please do engage with us, not just today, but going into the future. And just on that, we're going to have a little fun. So we're going to start off today with a poll. Nishan, if you don't mind pulling it up, please. You should see that appear in front of you. So just wondering if you've even read our paper. Yes, and you liked it? Yes, looking for more answers today, or not yet, but planning to. Notice I didn't say no, you don't have the option not to. So everyone will ultimately have to read this one way or the other. Just take a few seconds to fill that out, please. Okay, Nishan, I think you can show the results. All right, so sort of 3/4 of the people basically haven't quite read it yet or have some questions they want to, or to better understand it today. So that's good, and Arif and I'm just kind of bear that in mind as we go through as well. And when I kind of present the high-level points of the paper, I'll try and make sure that's fairly clear to everyone. Okay, you can stop sharing that, Nishan. All right, so first of all, just kind of setting the scene with you on why did we even embark on this initiative. Before we talk about the kind of specific challenges we were trying to address, I would just say that I think, like many of you would observe out there, the topic of digital health is very popular now, right? I mean, it's sort of, you almost can't go by a single day without this coming up. But what we perceived in the marketplace as it pertains to the scalability of digital health technologies, and specifically the kind of reimbursement and funding aspect, is that either they were going down a track of highly regulated path similar to a medical device, or it was kind of the opposite, that it was a totally unregulated situation. So there really wasn't anything bespoke in the middle, and that had quite a big impact on the innovations and how they were getting to market, and the potential impact onto healthcare systems. And here is basically what we describe as the paradox of the paper, which is, if you're a digital health technology innovator today, whether you're at a large company or a small company, you find yourself in this inability to implement because you don't have evidence, but then no evidence because you haven't yet implemented. And so that was really what we had core to our minds as we were going through this. But of course, there were some key issues that we were manifesting as part of this paper too. First of all, like I just said, basically there is no bespoke assessment for digital health technologies as it pertains to kind of the way health systems evaluate new innovations that they want to bring to market. So like I just said, it was either kind of one way or the other. There wasn't really anything highly tailored and specific. Secondly, the coverage that does exist for digital health technologies is quite fragmented. So even during COVID-19 times, we do find there's more reimbursement of things like telehealth, for example, but it tends to have a bit of a time box to it that it could eventually expire. At that point, what did we really achieve, right? Also, sometimes the amount of time it takes to get some of these digital health technologies approved is far exceeding the life cycle of normal digital innovations, right? 2+ years, which isn't too bad in medical standards, but again, from a digital innovation perspective, it's quite a bit of time. I think also on the coverage side, what we found is it can be confusing if you're an innovator in terms of who really owns the funding and reimbursement pathways in the different countries. And even some of the payer transformation efforts like bundled payment schemes create a lot of confusion in this situation, because whereas you could swap an existing procedure at the procedural coding level for a digital health technology, swap it, for a kind of current intervention, when you kind of bundle payments along the pathway, it creates a lot of opaqueness by the payers in terms of at the procedural level where those interventions could occur. So we came across some things like this as well. And then finally, if you're trying to get a digital kind of health technology into the market, it is this sort of delineated web of evidence requirements and financing kind of schemes, and it becomes very difficult to actually understand how to navigate. And we see a lot of old age kind of evidence requirements based on traditional kind of pharmaceutical or medical device clinical trials, randomized controlled trials, for example, which aren't exactly fit for purpose for digital health. And therefore, as an innovator, you would really have to question the investments you would be making in terms of the regulatory pathway versus maybe more of the B2C style model, which is a bit quicker. And I think in the end, the most unfortunate impact of all of this is out-of-pocket expenditures in the Asia Pacific for healthcare still tend to be quite high. So, once the digital technologies are able to get into the market, the ultimate kind of, person paying the price of this literally is often the individual. So these are things that we aimed to fix or to look at as part of the paper. Our approach, I think Roberto already framed it, and I've said it a little bit as well, was a bit twofold. So look at these issues, but then also come up with some possible solution ideas that the policymakers can take forward through a multi-stakeholder kind of advocacy party like the people that are convened on this forum today. So that's great. I think in terms of the approach as well, so we did a literature review and we use existing APACMed member information and other surveys and best practices that have been collated. But then we really got into the field. And as I said, we did this virtually, so we spoke to key stakeholders, policymakers, care providers, other constituent bases to get their perspectives across different countries and to kind of come up with these archetypes and solutions that I'll cover today. I think also key was, as Roberta said at the beginning, to interlock not only the reimbursement aspect of digital health, but the other things that APACMed covers, like interoperability, cybersecurity, et cetera, right? So that was important for us. And I'm not going to present it to you today, but also in the paper, you have a whole kind of scene setting aspect, which talks about the drive toward universal health coverage programs in the Asia Pacific, the remaining lack of health equity that's in the system, just trying to do more with less. And in the paper too, we have a kind of standard definition for digital health aligned to APACMed's main focus areas. And we kind of correspond this definition of digital health technologies with the overlay on things like Industry 4.0. So the whole point of that is, if you're a policymaker reading it, whether it be about UHC or Industry 4.0 or health equity, that at least is talking in terms that helps you understand the broader health and socioeconomic reform that you're trying to drive for your country. Okay, so I laid out a little bit of the issues we were trying to tackle and how we did the paper. And as I said, I'm not going to present everything today in the essence of time. There's a lot more information in the paper itself about setting the scene, but I will just kind of finish the presentation part of this by talking about some of the solution ideas that have been curated here. So one thing, as I said at the very beginning, is that there was not a standard value assessment approach for digital health technologies. Now, there is some cool stuff going on in places like UK, France, Korea. So one initiative parallel to this program with APACMed was to kind of collate some of these best practices. And that way, when we put forth a value assessment framework, it at least had some kind of evidence behind it. But I think the main thing here you can see on the page is what are the categories by which digital health should be measured from a value assessment perspective, because for many of you who are familiar with the health technology assessment, which is quite popular, this is where you end up treating digital health technology a bit more like a medical device than the other benefits that the digital health can provide. So classic stuff you would expect here, like safety and clinical and economic impact. This is still quite common of any health innovation, but we tried to expand that out even further to look at the social impacts that digital health can bring, the organizational aspects. So many digital health would fundamentally change the way the pathways work, right? The day-to-day practices of doctors or clinicians, efficiency gains, or just different skill sets that are needed. So we believe this is key to include in the value assessment. And then you get into more kind of technology-oriented stuff, right? So how user-friendly is it? I mean, we talk often about patient-centric systems or patient experience, but we really need to measure these digital health technologies by how user-friendly they are to the individuals as well. Technical aspects, infrastructure, interoperability, data security. So this is the whole kind of IT side of the digital health technologies that we should include as well. So again, a lot more information in the paper to kind of base that off of. I mentioned earlier we got some of this from existing good things that are going on in other markets. One of them was also Germany, which just recently has kind of launched this program whereby basically they allow a digital health technology to enter the market and to be reimbursed for up to a year in order to kind of test it out and see and be able to gather the evidence such that you could meet a value assessment approach like this. And then after a year, it's finally determined about whether full adoption and scalability could be needed. So this kind of helps that paradox that I talked about earlier, and we hope to see more of this type of thinking in the Asia Pacific. Also in the paper, we provide solutions not only just to the value assessment part, but to the reimbursement and funding aspects. So what we've done here is we basically came up with two archetypes. So we've got Australia and India, and the idea is, different socioeconomic statuses, different demographic statuses, different geographic statuses, right? So each kind of has its own set of challenges and opportunities in front of them. And we articulated across these two archetypes, where are they today with digital health? In fairness, a lot of countries, including India and Australia, already have blueprints. They are trying to make an effort to adopt and properly value and reimburse digital health. But where are they at today, and where could they go based on what we know about these country archetypes? So here we look at code switching, for example, as a kind of interim step before you would fully reimburse digital health as a new kind of category. The degree to which public system financing versus private system financing needs to come into play based on the design of the health system structure. We talk about where they can go from a post-market surveillance perspective for ongoing monitoring, and eventually how you can evolve health system contracting as a result of digital health into things like value-based contracting, for example. So this is also laid out in the paper in addition to the value assessment part is the archetypes part for the actual reimbursement pathways. Also in the paper, just again for everyone's reference, you can check it out, but we have many examples, including the heart flow analysis tool, which is the AI intervention for the cardiovascular space. We talk about their journey to get reimbursement in the Asia Pacific region. We do make reference to other existing tool sets from the WHO and HTA and whatnot, so you have that in there. And we also talk about alternative pathways because we're of course aware that public sector reimbursement is just one of many ways to be financed and in some ways reimbursed in these markets. So we provide some of the alternative pathways too. Okay, and then just lastly, we sort of conclude the paper with recommendations. The paper is oriented at the policy makers, right? So we provide them with recommendations for how they can sort of in a tangible way action what we put in front of them. Of course, a lot more discussion is needed. This is not meant to solve the world, but just give them some fodder for which they could act on, right? So we do it in kind of 3 steps. One is around, getting control of the situation that they operate in. The second would be around more strategic planning. And then the final one would be how they actually execute on that. So again, without going into too much detail, but situational analysis would be, first of all, just aligning with international standards on the categorization and definitions for digital health. Nowadays, groups like the WHO have put out very formal definitions, so we should standardize ourselves a little bit around this. And then really just kind of frame the size of the opportunity. So I talked earlier about UHC and health equity. There is a WHO toolkit by which you can actually measure how digital health can get you to the next phase of health equity in your system. And so you can use this to create a baseline by which the size of the problem exists. And then we would advise to a country government that they would basically just map to one of the 2 archetypes. And it won't be perfect, but it should be quite clear which one is the better fit for their socioeconomic and demographic status. And then we move into the planning phase, and here we talk about really a lot of formality for including digital health technologies into the national planning cycles. And I'm not just talking about a kind of line item bullet. We mean here a proper focus on the funding and reimbursement and value assessment that occurs within the normal planning cycles of national health systems. So we don't see that often enough. And then once you've done that, you're able to kind of formalize a task force here to achieve the objectives of that planning cycle. And again, you would want a multi-stakeholder group comprised of public and private sector and different types of players in the ecosystem to drive that task force. And then underneath that, to make it real, is to identify the local champions in the provider community, policy, regulatory, who can really drive this. Because we did come across in our research that as great as many countries have tried to do to put out blueprints and other kind of policies for digital health, that in the end, there wasn't anyone to take it from paper to a real exercise. And then just lastly, on the execution side of things, as you would expect, having a roadmap, but also publishing that, so where the entire population understands the direction you're trying to travel with digital health funding and reimbursement. Thinking about the people side of things, so the workforce that you need, the skill sets that will be impacted, the training, not just to use digital health, but to evaluate it and to properly fund it and support it, right? And then just having that ongoing monitoring process. So in the beginning, we would have baselined what the size of the prize potentially is. How is it going in alignment with national planning cycles? Are we achieving the objectives, or do we need to pivot our approach? So we tried to lay this out in some detail in the paper as well. That way, when we go to the policymakers and have the discussions, there's some quite tangible action points. And these are action points that collectively we can work on, APACMed and other groups, right? So that was kind of the idea behind that too. Okay, that was a lot of talking, and I don't want to do any more talking. I see some comments coming through from the chat as well, which is great. A lot of very positive feedback, so I appreciate that. I know a lot of you are passionate about this space, so please keep sharing your thoughts there. Next, we'll transition into the kind of fireside chat. So I've got 2 esteemed guests here who helped write this paper, and they're going to share their views. Before I introduce them and kind of go to that, we're going to run a couple of polls as well, just to interact with you. So Nishan, maybe you can pull up the second poll, please. Yeah, And so here, just trying to understand, from your perspective with the adoption of digital health in the Asia Pacific, where do you see as the biggest still sort of roadblock, Okay, a few more seconds. All right, Nishan, you want to close that one and share those results? And then we got one more quick poll here. Yep, so most of you said, really it's still the kind of process side of stuff, which is great, because I think that's one of the main focuses of this paper, is trying to lay some groundwork there. So thanks for that. Maybe the second or sort of third and final poll here. You can run that one, Nishan. And this is something we asked the interviewees as well, the different policymakers and sort of, providers and things in the countries is, at the end of the day, how much of digital health should be reimbursed, because there's different pros and cons, too. So let us know what you think. Few more seconds. Okay, Nishan, you can share those results. Yeah, so interesting. You believe yes, reimbursement, but some kind of mixed payment model, whether that be public-private or possibly some alternative pathways. So I would love if in the chat, if you want, for those of you who kind of believe this mixed payment model, would be great. You can kind of expand on your views on why you believe that to be the case. So I think for Anne, and thanks, Nishan, you can stop sharing that one now. Yeah. So for Anne and Arif, just to kind of recap here, most people haven't read the report or they need further explanation on it. Most people believe we've still got a kind of a process issue related to this topic, and then most people believe there should be some kind of mixed, payment model for reimbursement. So I think we'll see in the chat a little bit more detail about that. But let me stop sharing my screen here. And so now what I'll do, I'll call in each kind of fireside chat participant, and they'll sort of have a few minutes just to reflect on the theme itself, and then we'll get into some kind of discussion points. But again, please keep putting your ideas and feedback to us in the chat. So first of all, let me call on Anne. Anne is at Johnson & Johnson. She's on the Asia Pacific Health Economics and Outcomes Research team, which she can explain more about if she'd like, with specific focus on the orthopedic and biosurgery space. And one interesting thing about Anne is she has previously been on the other side of the table as a kind of regulator and value assessor with the French agencies. So I think she brings some interesting kind of dual views to this topic. But Anne, would love to hear your about yourself, your thoughts on the paper, and anything else you want to share before we go to Arif.
Sure. Thank you very much for the nice introduction, Chris. So I am in Johnson & Johnson in the medical device sector and responsible for health economics and market access, which is really looking at all this, the appropriate strategies to enable access of the J&J innovations to the Asia Pacific region. And I also have the honor of chairing the APACMed Digital Health Committee reimbursement work group, which we have with all the members of the work group developed this paper with you, Chris. I have more than 10 years of experience in both pharma and medical device. So really covering different disease areas such as immunology, CNS, and also across geographies. So Europe, where I grew up, and now in Asia Pacific. And also covering different functions to looking at really clinical practice as well as innovation and access to innovation. So through regulatory, medical affairs, health economics and outcome research, as well as market access. So as you have pointed out, I'm really passionate about shaping clinical practice and policy, having the opportunity to see both sides. And really, I would like to shape these policies to improve patient access to innovation. And as we have seen in your introduction, that digital health is really poised to transform healthcare, probably accelerated in the recent developments with the pandemic, but also because we are living in a very dynamic region that is Asia Pacific, very well versed and advanced in digital. Some might argue that more advanced maybe in some aspect than the Silicon Valley. So I'm really proud to be able to participate in this really dynamic ecosystem to build it as in APACMed and industry players. How can we collaborate with key stakeholders in this ecosystem to really improve access and adoption of these digital health technologies for a sustainable adoption and integration in the healthcare system. And healthcare, digital health in healthcare is actually also facing unique challenges, different from traditional medical devices. And also healthcare is a different industry from the others, such as e-commerce, where digital technologies might have a much faster growth and adoption. So that's why this paper really is a great starting point for us to help all these key players to think differently and change mindset in terms of how you approach digital health technologies. And I hope that we also provide in that paper some practical tools and indications for all of us to engage in these discussions and really move the needle.
Yeah, great. Many thanks, Anne, and congratulations once again to the committee for driving this effort. And I know it's really just the tip of the iceberg, honestly, because it's just kind of laying out some initial concepts and some possible frameworks, but a lot more discussion to be had, which is great, right? Because I mean, then you set the stage for good public-private sort of collaboration. So, okay, let me come on to our second Fireside Chat panelist here then. So Arif, he's Abbott's Asia Pacific Global Health and Economics and Reimbursement group. And he's got a long career in medical device and sort of medical device advocacy. So he brought a lot of experience from that perspective to this paper as well. Arif, would love to hear a little bit more about you and your focus areas and your reflections on this paper.
Thank you, Chris. So like Chris mentioned, I lead health economics and reimbursement for Abbott's medical device businesses in the Asia Pacific region. And digital health is a huge area of interest for me personally. And one thing which is quite clear is that if you look at the paper, that the emergence of digital health in a really big way in Asia Pacific is inevitable. However, digital health is not entirely new. I mean, we've had technologies that have lived amongst us over the last several years. One example could be remote monitoring of cardiac devices, which is also mentioned in the paper. But now I think what is happening with digital health is that it's getting into almost all areas of healthcare. And with this paper, where we look at the introduction of several hundreds of thousands of technologies that are coming out, whether they're in the AI space, the application space, the remote care space, and all of these are gaining a lot of popularity. However, for them to become mainstream, I think the most important thing is for them to get scale. And as you see from the poll as well, that appropriate funding and reimbursement is absolutely critical for creating access for these technologies. We also saw this with some of the older technologies. If you look at cardiac remote monitoring, those countries where this was sufficiently reimbursed were the ones where the penetration of the technology was a lot higher, as opposed to countries where it wasn't. But this is obviously easier said than done, because to determine appropriate levels of reimbursement, we first need a value assessment framework that's fit for purpose and appropriate for digital health. And I think this paper does a really nice job in recognizing that need and also laying a very important foundation, much of which we will use as we build up and work towards advocating in favor of digital health reimbursement in the region.
Great, thanks. And once again to you and your team as well for the strong contributions to this paper. I think it's clear not only your experience, but also your passion, which came through during the process. So thanks for that. Okay, well, let's kind of come on to the first discussion topic here, and I'll call on Anne first, so she has time to prepare while I'm saying this. And of course, you want to start any position paper with what are the challenges, kind of what is the potential risk if we don't do something right. And we laid that out in the paper, not only from a digital health perspective, but a broader socioeconomic and health transformation aspect, right? But I think, there is a lot of great stuff that goes on in the Asia Pacific region and on the innovation side, as well as on the kind of policy side. So I'd love each of your comments on just what is going well and where have some of the success stories been that the group listening today can feel inspired by and kind of learn from. So maybe Anne, start with you.
Right. So I think that in terms of success cases that we have seen across the world, so first in our region, I would say very much Korea, that you have already mentioned as one of the good inroads into looking at digital health technologies. For two reasons. One is really a government and policy push towards big data. So generating evidence and leveraging on the wealth of data that is being generated by digital health technologies to really inform decision making. And the other aspect is also establishing a separate reimbursement pathway, not unfortunately really specific to digital health technologies, but for innovative technologies. So there is a pathway that does include right now 3D printing and AI that is part of that, these innovative technologies. Moving beyond, you also have mentioned Germany, and I would also add Belgium in terms of good practices, and this for two reasons, again for multiple reasons. So Germany, both Germany and Belgium, they have actually established a one-stop platform where they are hosting and asking all the manufacturers to register their digital health technologies. And I think that it's really a great way to establish the trust actually around these digital health technologies. It's a certification that these technologies are safe to use. They have demonstrated effectiveness, clinically speaking, and they have all gone through a proper review process that is mandated and led by different government agencies. And there are also, they have put in place in that process also the link with funding and reimbursement. So Germany has really put it as an overall and national coverage with very good conditional coverage as the digital health technologies are producing the evidence to demonstrate their value. In Belgium, actually, the cost of initiating that evidence is actually borne for one pilot, one project by actually the government itself. So it's really great to see that these technologies benefit from a separate framework and reimbursement funding processes. And I think that these are great aspect that we can take for our region.
Yeah, wonderful, Anna. It was a fun little kind of world tour, and I think I hope many people have this philosophy as it pertains to sort of healthcare policy shaping, that good ideas can come from anywhere, right? It's just about sort of knowing them and how you can sort of tailor them and leverage them. I think it's great as well for this paper that the Korean National Agency for kind of health evaluation and evidence was able to contribute to, because as you said, they're doing a lot of interesting things there that we can learn from. So well done. Arif, same question to you, if you'd like to add on to what Anne said, or if you have other kind of perspectives here on some good things going on.
Sure, thank you, Chris. I think every country within Asia Pacific currently is trying to embrace digital health in their health systems. And this is a very, very healthy sign. It's exciting for the country because they're modernizing their infrastructure, they're digitizing a lot of things that were previously not digital. It's great for manufacturers and developers who can now build solutions to overcome some of the more fundamental problems with conventional healthcare, things like access and geographic availability, awareness and equity, which you also mentioned in the paper. And I think most importantly, it's great for patients. I mean, take the example, I mentioned remote monitoring earlier. Take the example of cardiac patients with implantable devices such as pacemakers or ICDs. In countries where adoption of remote monitoring was high due to adequate funding and reimbursement, during the pandemic, this was a boon, because where instead of lining up outside of a hospital with the risk of contracting the infection, important information from such devices could be sent over to the physician securely, which allowed in many cases for patients to actually schedule the appointments with their physicians as and when required. So I would say that there are a number of existing examples across the region where we have seen that appropriate adoption of digital health has been a huge success all the way around, not just for developers of these technologies, but also more importantly for patients as well as the health system overall.
Yeah, good. And while you've got the microphone, and I think it's great that sort of, obviously we've talked a bit at a policy level, but you've also brought it down into kind of the solution kind of pathway sort of service level too, which is important, right? At the end of the day, it has to have some type of real impact on the way healthcare works. So while you've got the microphone, maybe I can just ask you to expand on this a little bit. So where do you see the real impacts of digital health taking place? And I frame this because in our paper, of course, a lot of people talk about all the amazing things that digital health can do, right? And if you want to elaborate on that further, you certainly can. But in our paper, we also kind of teed up that actually, if you don't formalize the assessment and kind of reimbursement of digital health, you could have negative effects as well, right? In terms of increasing out-of-pocket expenditures or medical errors on tools that were not properly validated, right? So yeah, maybe just a few remarks on kind of the impacts that you see going forward with digital health.
That's a very important question, and I think the main solution to this and the short answer to this is for this to be successful, digital health will need to achieve scale. And for digital health to achieve scale, this would need to be done at almost an unprecedented level, where you would need to look at this across the continuum of care, starting with diagnosis, where you'd be able to catch the disease early. You would want to allow appropriate intervention so that the patients, when they need treatment, they can have timely intervention, followed by post-procedural monitoring and disease management. And across this continuum of care, there are different elements of funding and reimbursement which will enable this to happen. But the diffusion and adoption of technology is very important. This, if successful, will allow avoiding unnecessary clinical events, hospital admissions, things like improving outcomes, and ultimately saving cost. I have an actual example that I can share with you. So we make a diagnostic monitor called ConfirmRx, which is used for diagnosing irregular heart rhythm. Now, it detects abnormalities even when the patient is asymptomatic and transmits it to the patient. It transmits it to the physician. Now, once this patient is diagnosed with this condition, the physician can decide to treat this patient with, some sort of therapy. And say, for instance, if they get implanted with one of the cardiac rhythm management implants, then the patient has an option to go for remote monitoring, which then allows you to even follow through post-procedure. So this will be successful. The way it will transform healthcare if it's across the continuum of care. It will need to integrate from end to end. So we start with diagnosis, look at therapy, and then disease management. And this whole continuum needs to be digitized in a way that it benefits the patient and benefits the health system.
So, Anne, I think if we hear what Arif says, right, he's talking about the incredible power of some of these innovations, which I think many are waking up to if they weren't already woken up already. And of course, Johnson & Johnson are similar, right? I mean, they've got all these great innovations that they're partnering with, they're trying to kind of deploy out there as well. So, why do we need then the specific policies around digital health assessments and reimbursement? Why can't we just sort of do things the way that they were done today?
Right, a very challenging question, and that is a little bit in my introduction, and I in the paper we have outlined some of these aspects. So the way you see digital health, or let's say right now, how medical devices or drugs and treatments are being funded and reimbursed is very much a narrow view that only takes into account clinical benefit. Really what Arif was saying about the importance of looking at the continuum of care is to really, we need to change our mindset to have that more holistic view of the patient pathway. I might say that if we need to go to a surgery and reimburse that treatment, it might be a bit too late. It is really about intercepting the disease, working on all these prevention for the critical care not to happen. That would be, I'd say, the ideal healthcare future that we would like to see, and that would unburden a lot on the healthcare expenditure. So in that way, so I'd say that really that change in the mindset on what do we need to reimburse, and therefore how do we reimburse and fund these technologies, is really to take into account more than just patient outcomes. And these are the different dimensions that we are proposing in our paper, and in particular, the socio-economic dimension of digital health technologies, because many of them may not have a direct impact on the patient outcome, but holistically and overall would really provide efficiency and alleviate the burden on the healthcare providers and costs and time and resources to the providers and those who are delivering the care. So the other aspect also is around, obviously, in order to make that decision around funding and reimbursement, we need to have a proper evaluation framework and the evidence to be suitable for that. But when you look at digital health technology, they are poised to actually change the way you deliver the care. The Arif's examples is really great. So we are actually changing the way you treat patients. So what comparator should we use? And that is actually a very difficult question for digital health technologies. You can't compare it to a normal surgery. We also have to recognize the specific characteristic of digital health technologies, which are rapidly changing and evolving. From the time you start your clinical trial of a randomized clinical trial, that has to last at least 2 or 3 years, you already have moved on to version 10 of your digital health technology. It would be really a logistical nightmare for the manufacturers to undertake the evidence that needs to be generated to support the value of these digital health technologies. And therefore, we would like to really suggest more flexible and adaptive evidence requirements in order to really fully appreciate the value of all these digital health technologies. And then lastly, obviously, digital health technologies are touching different types of population and behaviors. These targets are maybe not as straightforward as your traditional medical devices and impact different levels of organization that would impact the hospital, the care delivery from home base to clinics, and how it's going to change. And so how do you really appreciate all these values would be very much different from your traditional medical device. And again, that's why we encourage policymakers to really think broadly and integrate other dimensions in the value assessment.
Great, thanks. I really, that was very thorough. Can't add too much more to that. But what I hope for the people listening out there is, I think often I find in the healthcare ecosystem, people are a bit disconnected from the policy side of things. And it's not meant to say that everybody needs to be a policy guru, but just to understand the importance of good policy in making healthcare work and adopt the things that it needs to adopt, right? And at the end of the day, healthcare is a highly regulated industry, so it's a bit of a disservice when you treat something like digital health, not in the right way. And I think the whole point of what Anne is saying is just the appropriateness aspect of not too much, not too little, but what is the right amount for something like digital health. And so the real aim of this paper is the policy side. So I hope people can, irrespective of what role you have in the ecosystem, kind of get excited around that. Okay, I do have a couple more questions I want to run through before we hand it back to Roberta, so we might need to keep our answers a bit tighter here as we come to the kind of closure. So one thing I think is always the question of the hour, which is COVID-19, right? Of course, we could have had this discussion 2 years ago about pre-COVID-19 about digital health and adoption and healthcare transformation, right? But here we are, in the middle, maybe hopefully toward the end of COVID-19. So how do you think everything we've discussed today changes as a result of COVID-19? Could be better, could be more challenging, but we'd love each of your perspectives on that. So maybe Anne, while you've got the mic there, I just call on you and I go back to Arif.
Right. Well, I think that maybe Arif, would you like to take that up?
Sorry, first? Arif is supposed to be first on this one. Yeah, sorry. Go ahead, Arif. Yeah.
Yeah, I think COVID-19, the short answer is that it has accelerated digital health in an unprecedented manner. I think we should really admire the speed and agility of how everybody has sort of played a role. And if you look at the role of the industry, look at governments and payers and how they've responded during the pandemic is quite remarkable. If you kind of break that down in terms of what's the responsibility of each of these different stakeholders as we come out of the pandemic, I think digital health will continue to accelerate in a really big way, like I mentioned earlier. But from a manufacturer's perspective, I think, or a developer's perspective, it's really important that we insert digital health technologies in the health system and in patient lives in the most unobtrusive way. And what I mean by that is, again, going back to the earlier example which I gave on remote monitoring, where previous versions of some of these devices which required remote monitoring had bedside transmitters. So basically, you were locked or chained to a bed where your device would only transmit when you were near this device. Some of the new technologies that are coming out are app-based. So as long as the patient is carrying their mobile phone, they can move around and the device will continue to communicate with their physician. This is a very important innovation which will ease in remote monitoring and digital health in the lives of patients. If you look at it from a payer perspective, I think the appreciation of moving from a physical box to an app is quite a bit of a shift. And when we look at APAC and how medical devices get reimbursed, most of our markets pay for the physical device. So I think that is where there is considerable amount of appreciation of technology and how digital health is impacting needs to take place, going to the points that Anne raised and how you would present such findings. And then I think from a policymaker perspective, the things that would have been sluggish have been have changed very fast over the last 1 year. And I think that's really the agility and the speed to which I mentioned earlier. So I think if in order for all of this to work, it needs to be that everyone needs to play their part. That's how I would summarize what COVID is, how it is influencing digital health reimbursement.
Yeah, I think well said. Obviously, a lot more attention to this topic, but I think hopefully, like me, many people have seen just a real collaboration and kind of camaraderie going on out there. So possibly some good platforms here for what we're trying to achieve with this paper too. Anne, how about you? Sorry for swapping the order there, but now to you.
Right. So yeah, I would build on what Arif has said. It's really the pandemic has accelerated the acceptance and adoption of digital health technologies, especially for providers, healthcare professionals, and patients. They can really see that nowadays care can be delivered virtually in complement to the face-to-face and without compromising the quality of the care provided. It also, the other aspect is that it also helps patients to be more IT savvy, digital savvy, and therefore help them to overcome maybe some concerns or reluctance they might have towards digital health technologies. And it also compel, I'd say that some of the pressures that providers has experienced through the pandemic was also the need to not just focus on patient outcomes, again, but also to look at the economic aspect of healthcare delivery and how they can become more efficient. And this is where also I see that digital health technologies would be able to provide a lot of solutions to providers in that aspect. It also has enabled patients in more remote areas to have access to these digital solutions, otherwise would have been more difficult. But unfortunately, there's also some challenges that the pandemic has brought in. And I'd say that given the priority for everyone right now around the coronavirus management, and that would mean that in the next short to mid-term, we'll see the budget constraints from these healthcare providers, and that might limit some adoptions of new technologies.
Yeah, I love the point you made about individual people as well, because I think one always challenge with health system policy was at the end of the day, what do individual people do, right? And as a result of COVID-19, I think healthcare literacies have gone up quite a bit. So there's some good momentum here. And when we talk about this, task force that needs to be formed at the country level to really properly value and reimburse digital health technologies, we must also remember all the kind of people. And I know in the value assessment framework, we included things like user experience, right? Because that's going to be pretty key going forward. Okay, I know we're coming up on time, and we have some closing remarks from APACMed too. So I just want to ask each Fireside Chat panelist one kind of final remark. So this initiative was kind of done by APACMed. I know many on the phone today are part of APACMed. For those who aren't, definitely check it out. But what role do you see of APACMed in kind of being able to drive this and sort of really influence the way digital health technologies are treated in the Asia Pacific going forward? So maybe Arif, I start with you, and then I come back to Anne. That's okay.
Sure. So I think APACMed is doing some really good work here, and within the 1 year that we've been a part of the reimbursement working group, a lot of good work has happened in making sure that we identify the problem, and now moving forward, how do we address this? And Roberta will talk more about what are the next steps from a committee perspective. But I think from my standpoint, it's really important that some of the things that I earlier mentioned, that we need to be looking at digital health across the continuum of care. That's really, really important. The other thing is that the different stakeholders who need to be involved all need to be playing some sort of a part in order for this to be successful. And then eventually the way it will become mainstream is when it will pick up scale. But the way the picking up scale, you'd have these sort of building blocks, which I mentioned earlier, which will be really important for us to see how digital health is moving in the future.
Good plug, thanks, and I once again appreciate you and your team's contribution to this effort too. So Anne, as chair of the committee, that's why I thought I would come to you second on this one. So your thoughts on how APACMed can drive this, and then we'll kick it back over to APACMed.
Right. Thank you, Chris. I think that what I would really like to see is that this position paper is really just a starting point for discussion, and we hope that you would be able to use this tool or parts of it in terms of content to engage with policymakers, regulators, payer, and other stakeholders in this very exciting and dynamic ecosystem to drive a sustainable access and adoption model for digital health technologies. So I would really encourage all of you to be involved with APACMed to help us drive that space. So answering the question that I see here on the chat from Hasna is that it's absolutely a great place now for us to shape the policy to maybe more harmonized framework for digital health in the region, because I think that everyone right now is finding its way towards managing these digital health technologies, very, very specific and unique technologies that are going to change the way you see healthcare in the future. So I would really encourage you to really leverage on this tool and all the materials that an asset that APACMed is producing to help you in this journey.
Wonderful. Well, I hope for the sort of 3/4 of you who at the beginning either hadn't read the paper or wanted more information, that was an enlightening session, the start of a lot of things to come for sure. I know a lot of you on the call today actually contributed to the paper, so thanks for your remarks as well from different countries and sort of aspects of the ecosystem. And as the other two have said, I would just recommend to stay active in this. We're just starting and there's a lot more to go, and there's kind of roles for everyone to play here. So on that, let me hand it back to Roberta to talk about what the next steps are with this initiative. Roberta, over to you.
Thanks a lot, Chris. Thanks, Arif and Anne, for launching the work today. So I will be super quick on the next steps. Of course, this is a very important foundational work, but the reason why we came up as a group to write this paper was to start initiatives on the ground within our APAC region. So what we will do next actually is to establish some country task forces with our members and external stakeholders. So we want to engage this year on the ground. We will start with 2 priority countries that we have prioritized within the association, India and Australia. And the idea is to use concretely the recommendation from our paper with policymakers, with payers, and I think there was a question from the chat, the healthcare professionals, the healthcare providers, the hospitals, what we can do as an ecosystem to, make sure this framework is, translated to reality. So this year we will be busy in doing that. There will be a lot of ecosystem creation. There will be a lot of advocacy. There will be a lot of engagement on the ground. And as Anne mentioned earlier, so we are always happy to welcome feedbacks and inputs and help from the industry. So you can connect with us in the future and follow us on LinkedIn. We are usually quite active there, and we try to share as much as we can. With that said, I think we are at the end of our webinar. Thanks a lot for joining. Thanks a lot for your questions and for your perspective, Arif and Anne, and for the support, Chris. And yeah, I wish you a lovely end of the day and talk soon. Bye.
Thank you. Bye-bye.
Thank you.